Hello, everyone, and welcome to another episode of Faces with Phyla, where we talk about phage technology and acne. I'm your host, Yug Varma. I am a scientist with a PhD from Johns Hopkins University. I'm a microbiologist and a biochemist who studied the microbiome for 15 years now. And I am also the founder of Phyla, where we use phage technology in acne. Joining me today is Dr. Efe Kakpovbia. She is a board-certified dermatologist based in New York. She's originally from Calgary, Canada, and she received her medical degree from NYU Grossman School of Medicine, where she's now an assistant professor. Amongst her many areas of expertise is the treatment of acne, skin of color, and hair disorders. So welcome, Efe. So good to see you again. How are you doing?
Thank you. Thank you for having me. I'm doing well. Very excited to chat more about Phyla today.
Amazing, amazing. So I know your practice focuses on acne treatments. Can you start off by telling us what are some of the tools you use in your toolbox and how do you apply them?
Yeah, I think it very much will depend on the form of acne that we're seeing. I mean, we know that there's four key pathogenic drivers for acne. There's inflammation, there's sebum overproduction, the overproduction of C. acne, as well as inflammation. And depending on what I'm seeing on the patient, they may have a little bit of a stronger inflammatory component versus keratoconus increased follicular plugging component versus a combination hormonal. So I really try to figure out exactly what may be particularly driving a person's acne. But in reality, I'm usually definitely reaching for a retinoid. It tends to target a lot of those key pathogenic factors, topical or oral antibiotics, anti-androgens, and then definitely a big proponent of accutane because it is one of those treatment options that's going to target all four of those pathogenic factors. But again, really depends on the patient, which will tell me exactly how I want to, combine these different topical and oral options.
Yeah, and that's important. But what's also important is what the patients are saying to you, right? So you're diagnosing them and looking at the degree of sort of inflammatory, non-inflammatory lesions they have and the type of acne that they have. But in addition to that, what are you hearing from the patients? What are some of their top concerns?
Yeah, I think a lot of them want a treatment that's going to be effective while minimizing some of those typical cutaneous side effects. I'm thinking about dryness, peeling, irritation. A lot of people are hesitant to use things like retinoids because they do dread that peeling. And I really try to advocate for retinoids because they do work very well, but a lot of people just would prefer to opt for a more gentler option. Antibiotics, a lot of people have been on and off topical plus or minus oral antibiotics for many years because we know that acne tends to develop initially in that adolescent phase, but a lot of people will have a more prolonged course where it's been consistently flaring and they've just had to try a lot of treatment options. And sometimes antibiotics work very well in terms of calming down those really severe flares, but it really is a band-aid. It's not a long-term fix. And in order for us to be really good antibiotic stewards, making sure that we're not promoting additional resistance, that we're not impacting the microbiome, we really can't have patients on it for too long. So a lot of people do come in saying they really want to avoid antibiotics, both topical and oral, because they just feel like they've been doing that and they're really not getting that sustained clearance.
Yes, that's so important because now I think I read the statistic that 1 in 6 infections worldwide are now drug resistant.
Yeah.
And, we have to be very careful of making that problem worse. And it's heartening to hear that patients themselves have that awareness where they understand the kind of limitations of antibiotics and want something different. I know that you devote time to research in addition to your clinical practice. What are some new and emerging approaches to acne that excite you?
That's the sad part in that there's a lot of research in terms of figuring out, okay, what is the ideal topical regimen? Or with Accutane, for example, how long are we having patients on it? Is there an ideal way to be dosing it or a cumulative dose? But when it comes to hearing very new emergent technology, I do think we we have ways to go in the acne sphere. It's such a common disorder. We see, at least I see people with acne all the time, every day. And sometimes I do struggle with patients where I'm feeling like I'm getting to my limits in terms of what additional options I have for them. A lot of times they've come in and they've tried a lot of different topical options. And yeah, I haven't reached a point yet where I really don't have any options. But every now and then, yeah, I struggle with figuring out which way do I pivot if they've really already utilized a lot of those more common therapeutics that we have. So it would be nice to get a little more options for people.
Yeah, that's something that we've heard over and over again from providers as well, including, podium speakers at conferences where they say, there's really been a lack of innovation in acne, not because the tools that we have are perfect and, have solved the problem, or that there's less of a demand, because obviously acne is the #1 dermatological condition.
Absolutely.
It's a nearly universal skin condition. More than 85% of people get it. And I think in this milieu, in this environment of a lack of innovation, we are developing phage technology, which is a novel approach to acne. And it focuses on reducing C. acnes levels without reducing the beneficial bacteria or killing the beneficial bacteria on the skin. So what do you see as the benefits of this approach? I know you talked a little bit about acne pathogenesis and the 4 steps. So how do you see the benefits of this approach versus some of the other antibacterial approaches specifically in your tools?
Well, it's nice to have another option that's targeting that C. acne overgrowth that's not an antibiotic, because again, a lot of people are hesitant to go that route. And so it's clearly an important part of acne development that we do need to target. So sometimes I am thinking, yeah, someone could benefit from topical clindamycin, like they really do have that inflammatory component. But again, it would be nice to tell patients, yeah, this is what maybe one option, but if you really are trying to avoid any form of antibiotic, then this is something else that's going to, also address that bacterial burden that we know is, contributing to acne. So it's nice to think of it as something where it's, again, has an antibacterial or targeting bacteria in a different mechanism. And knowing that it actually works in that way is also nice, because of course my goal is to give people options that are effective and hopefully are something that they can tolerate. So knowing that it could potentially do both is really nice to have as another option in my toolbox of acne treatments.
Yeah, that I think is really important, and just the way how phages work, right? Not only are they extremely targeted, so they're going to have no off-target effects because they only kill the bacteria causing the disease. But in particularly for acne, the phages that we use that target C. acnes, they've been shown to be naturally abundant on healthy skin and deficient on acne skin. In other words, 85% of us get acne at some point in our lives. And for that segment of the population, phages seem to be deficient or not present on our skin. But for the 15% who kind of magically avoid or sidestep having acne, phages are actually quite abundant on their skin. And this points to the fact, especially given their mechanism of action, that they may have a role to play in, the avoidance of acne. So phages obviously represent a new modality and a new kind of wave of science, which I broadly call microbiome therapeutics. What is your view of microbiome therapeutics in skincare and in acne? Do you think it has promise? Are you seeing sort of interest from your patients or from fellow providers in these technologies?
Yeah, I could imagine it has a lot of promise, because I think people are looking for some more quote unquote natural ways to sort of address their skin conditions. And so a lot of times people come to me and say, what about my diet? Like, how can I adjust that to better address my acne? And we have some data for, certain things that we know could trigger it. And then in other ways, I'm sort of just throwing out at them, just be healthy, eat a healthy diet, and maybe that'll help. And so there's definitely a lot of people who, or even like the hormonal route, they don't want to block any form of, hormones systemically, because they just don't know how that's impacting their general health. So I think a lot of people are just looking for ways that they can address their acne in a way that may be a little bit healthier to their overall, skin barrier, their gut health, and again, is effective. So giving them that option, I can imagine a lot of people would like to have, a different treatment option that seems to be both effective, but also not one that's going to really disrupt their overall well-being and their skin health.
So how does Phyla fit into your practice?
Yeah, I think I really like to provide it as an option for people who want something that's not going to be super irritating. I feel like the product itself is very gentle, is very safe to use on a lot of skin types. And so I definitely find myself asking all my acne patients, is your skin dry? Is it more oily? Is it combination? A lot of people find, especially if, we're talking about their acne in the wintertime, they are dry. So they want something that's going to be effective, but also not going to really lead to more dryness and irritation, and then prevent them from actually wanting to use something. And so I do like it as something that they can add into their routine that hopefully doesn't overcomplicate things, because, everyone should be cleansing their face and, using a good moisturizer. So it's something that they could, add as a complement to some of the things that, I more typically use for acne, like retinoids. Again, I'm a really big fan of retinoids because I just think that they work and we've had them for so long. But if that's something that we really can't approach, some people really don't want to touch them, then it's nice to have this as another option, or again, as an adjunctive therapy to some of the other topicals that I'm using. It really depends on the patient and what they're trying to get out of their treatment, and also how they feel like their skin is doing.
Amazing. Is there an ideal patient type for Phyla in your mind?
I think the one where I would probably be more quick to introduce it is that patient who clearly has inflammatory lesions and who is looking for a way to address that in a way that's not going to be super harsh, irritating, and maybe not necessarily some of the more common topicals where maybe they just, again, don't feel very up for using an antibiotic. But in general, I do think that really any patient could benefit from it, as you were saying, with that, that healthy versus more acne-prone skin is going to have a different population of that C. acne. And again, I think, some people have a little more of an inflammatory component than others, but most people have some of that to some degree. And of course, I'm sure most of the acne patients, again, are having that C. acne overgrowth. So I think it really could benefit anybody who's coming in and telling me that they have acne breakouts. But I think maybe there's certain populations where it'll be a little more at the absolute top of my mind.
Yeah. And I think, sort of going back to one thing you had mentioned, I feel like now there's an increased prevalence of sensitive skin amongst people. And a lot of people, come or, either come to the clinic or want to try products that don't have side effects. So how big is kind of concern about side effects of acne products kind of driving your or their selection of, acne medication?
I think a good chunk of my patients, it's a common side effect. I mean, I do live in New York, so where our summers can be intense, but so can our winters. And so especially as we're getting into, fall, winter period, that idea of I don't want to dry out my skin more is a really big factor for a lot of my patients that I see. And sometimes we're just completely changing their routine around that time because they truly just can't tolerate some of those more common topical treatments. So again, I ask all my patients, are you dry? Are you sensitive? Are you combination? Because that definitely does help me determine what topicals they may be better able to tolerate. But I would say all year round, but especially in those colder climates, it's a really big issue for a lot of people.
Yeah, and to your point, I think seasonality also is a factor in how patients, choose their acne medication, and unfortunately how compliant they are as well. Because if they feel like it's winter time and they're seeing these side effects like redness and dryness that are hurting their skin, or preventing them from maybe using other products or being able to go out into the winter weather, then they're going to be less compliant.
Yeah, and at that point, I'm like, I'm not going to force you with anything. If you're telling me your skin is peeling and you're dry and you're irritated, I mean, we got to think about something else. So if it comes up and they're really concerned about it, it's definitely important to bring in some other options for them.
Yeah, and I think this is where the thinking of phages and phyla as an adjunctive to therapies is also very useful, because it's really the flexibility of this modality where the phages are supplementing your skin, right? They're present on healthy skin, so we're trying to put something that's healthy for you on your skin. The effect that it has on the microbiome is a balancing one. So it's reducing the overgrowth of C. acnes and the inflammation that comes along with it, and balancing the microbiome. And all of this can be done sort of in the background when you're using something like retinoids, right? Which can be
Exactly.
harsh. And it's very important to use an adjunctive that doesn't exacerbate that doesn't pile on top of kind of the sensitivity that it can bring. And so I think its value as an adjunctive is as valuable or as important as its value kind of as a standalone as well.
Absolutely. And again, easy to incorporate. It's not like, we're adding a lot onto an already needed routine or skincare routine that's particularly for acne. It's just sort of like, okay, try this, cleanser, moisturizer, see if that's going to be really helpful, maybe on top of the topical you're using or in isolation, depending on how the patient is feeling about their skin.
Yeah. Now, acne is a chronic condition, right? And it affects us or follows us over months and years. So, what are some of your recommendations for the long-term management of acne?
Yeah, I mean, I think there's certain things that I think everybody needs to do just for general skin health, cleansing your face, removing dirt, extra buildup, oil, makeup at the end of the day, changing pillowcases, making sure we're washing our hair regularly, avoiding really comedogenic products. All of that's very important. And I try to, at some point counsel my patients on that. Hopefully I've built a longitudinal relationship with my acne patients. So if not addressed at the first visit, at some point in our relationship, we're going to have that conversation about just like routine, basic things that you should be doing for your skin, whether you suffer from acne or not. But if you are getting breakouts, again, keeping that skin barrier very intact, and also making sure that we're, not overdoing it in terms of oil production, and also not causing too much dryness, because that could also then trigger acne flares. So trying to balance out that kind of optimal skin environment is very important. And it's different, again, depending on the person and how their skin behaves. I know some people are very much prone to just like stress breakouts. So then we're having a conversation about, okay, clearly you're the type who is, going to get these flares maybe around stressful periods, and we can try to figure out a routine to kind of manage those periods. And then maybe at other times they're doing completely fine. So yeah, everybody's different in terms of how their skin behaves, but there's certain things that just generally we should all be doing to keep our skin nice and healthy. Moisturizing as well, sunscreen, all those things.
Yeah, absolutely. And I think it's all of the above, right? Because, treating your skin well is so much more than just the absence of pimples or zits on them. And for the long-term management of acne, people's acne looks different. Some may have relapses, some may have the occasional flare-up, some may have hormonal acne, right, which is more cyclical. And so the needs are different. And to your point of keeping the skin barrier intact, the microbiome is a very important aspect of that. And it really does kind of gatekeep the how much inflammation builds up on the skin, or the absence of inflammation, which is the hallmark of a balanced microbiome. So I think that long-term management of acne needs kind of a multi-pronged approach, and I think luckily more and more people nowadays are oriented towards a long-term view of skin health instead of trying harsh products on their skin and looking for that quick fix. I think a lot of them are naturally oriented towards a version of skin health that requires more care but results in better skin for the longer term.
Yeah, I agree. I think people are realizing that, when it comes to the skin, it's sometimes it's I mean, let me take that back because I think some people still are, throwing a lot of stuff at their skin, maybe not as like natural products, but just kind of layering a bunch of things that's then stripping that moisture, impacting the microbiome, the skin barrier. But in reality, we sometimes it's gentle, quick, or not even quick, but just gentle, very basic routines to just kind of keep the skin nice and healthy. But I do think a lot of people, I mean, and I get it, some people are just desperate, they're looking for something that's going to help just clear that acne. A lot of people know, don't squeeze your pimples, but they'll do it anyways because they're just really trying to get that, really inflamed bump to go down. So I also get that side where sometimes, yeah, you just want to throw anything at it. But I think most people are realizing that, yes, the skin wants gentle, effective solutions.
Yes, absolutely. And on that note, with a very good pearl on the long-term management of acne, I will leave it. Effie, thank you so much for contributing to Faces of Phyla. Really great having you here.
Thank you. Thank you for having me. I always love to talk about acne. Always.
Amazing. Amazing. And again, I'm Dr. Yug Varma. I've been your host, and I will see you again for another episode.